Good afternoon, and our today's topic for the lecture is Adolescence Clinical and Psychological Association. So you can see the stages of growth in a human life. So what is adolescence? Adolescence is a stage of human development encompassing the transition from childhood to adulthood. It came from Latin word adolescere, which means to grow into maturity. Puberty is the biological changes and sexual maturation during this transition. And what is the biological development? Biological development means there can be physical development as well as psychological and mental development. The physical changes, in fact, also the psychological changes of puberty are primarily the result of hormonal activity under the influence of central nervous system. WHO has defined adolescence in different stages. WHO says age period of age between 10 to 19 years of both sexes, married or unmarried, is included in adolescence. Youth is 15 to 24 years, young people 10 to 24 years, and this is the most healthiest period of life and the most problematic also. So you can see a saying from Louis J. Kaplan that adolescence represents an inner emotional upheaval, a struggle between the eternal human wish to cling to the past and the equally powerful wish to get on with the future. Many of you are still in your adolescent uh, age, and you must be remembering how during the initial pubertal ages, most of you must be trying to cling to your childhood days, and equally you must be feeling that I am an adult. Okay, that time period is known as adolescence, and the um, that changes is known as pubertal changes. Demography: about one-fifth of the total world population, that is, one in every human on this planet, is an adolescent. 85% of them live in developing countries. About India, 22.8% of Indian population are adolescents. 230 million adolescents was in India according to the census of 2001. Half of the group is sexually active before marriage. They have low knowledge about family planning and healthy sexuality, and this results in unsafe motherhood, maternal mortality rate, and infant mortality rate. Okay. Special features of adolescence. This is a stage where there is rapid physical growth and development. Physical, social, and psychological development, sexual maturity and onset of sexual activity, experimentation, transition from total socio-economic dependence to relative independence, onset of reproductive cycle, development of adult mental process and adult identity. Okay? The day the child realizes that all adults are imperfect, he becomes an adolescent. Okay? The day he forgives them, he becomes an adult. The day he forgives himself, he becomes wise. Now coming to different stages of adolescence. Early adolescence is about 10 to 13 years and is characterized by a spurt of growth and the beginning of sexual maturation. Young people start to think abstractly. Mid-adolescence is between 14 to 15 years of age. And the main physical changes get completed while the individual develops a stronger sense of identity and relates more strongly to his or her peer group. Thinking becomes more reflective. Later adolescence, about 16 to 19 years of age, the body takes its adult form while the individual now has a distinct identity and more settled ideas and opinion. Developmental stages in boys and girls. You must have studied tomorrow also, or yesterday also, about the Tanner staging in boys and girls. So let's have a brief overview. In the boys, testes increases in size, genital hair, that is puberty increases, axillary hair growth, facial and body hair growth, penis increases in size, height velocity peaks, larynx enlarges and voice deepens, and sometimes there are ejaculations that occur at night, that is nocturnal emission, also known as wet dreams. While in girls, there is breast development known as thelarchy, genital hair growth or pubarchy, and axillary hair growth, that is adrenarchy. After these three stages, there is height velocity peaking, and finally the menstruation begins, and this is known as menarche. Final development to adult status of pubic hair, breast, and height also takes place. A small table of Tanner staging. You can see there is 5 stages: stage 1, 2, 3, 4, 5. First stage is the prepubertal stage, that is, there is no sexual development in both boys and girls. In stage 2, in the boys, testes enlarges and there is body odor. In girls, there is breast budding, first pubic hair, and body odor, along with height spurt. Stage 3, penis enlarges, pubic hair starts growing, ejaculations can be seen. In girls, there is breast enlargement, pubic hair darkens and becomes curlier, vaginal discharge, and onset of menstruation starts in stage 4. Stage 4, continued enlargement of testes and penis. Penis and scrotal sac deepens in color, pubic hair curlier and coarser, height spurt. Male breast development also occurs. In females, there is onset of menstruation and nipple is distinct from areola. Stage 5, the fully mature male is formed, pubic hair extends to inner thighs, increase in height slows then stops. Similarly, in females, fully mature female is formed, pubic hair extends to inner thighs and there is increase in height with uh, slows and then stops. Pictorial depiction. Okay. Now finally coming to our main topic. What are all are the things that occur during the formation of an adolescent? During the adolescent development, there is physical, social, emotional, and cognitive development. What are the physical growth? The skeletal growth occur. There is secondary growth spurt, that is about 25% of adult height is reached in the adolescent, means 25% of growth occurs in this period only. Body composition changes. There is weight gain, increase in adipose tissue in girls, and increase in muscle mass in boys. There is maturation of reproductive system. Reproductive system maturation means there is hormonal changes and secondary sexual character changes. Hormonal changes are FSH, LH, estradiol, testosterone, adrenal, and androgen hormone secretion starts. Secondary sexual characters are the breast development, hair, pubic and axillary hair growth, and finally development of inner genitalia, inner and outer genitalia. Psychosocial development, Adolescents show less interest in parental activities, they have mood swings, they show intense relationship with same and opposite sex friends, increased cognition and increased need for privacy. They have lack of impulse control, but along with this, they have increased intellectual ability, and finally, they have risk-taking behavior. Now, what is cognition? Cognitive development. Cognitive thinking accumulates with the capacity for abstract thinking. This is the period of formal operation, each Piaget's fourth and last step. They think beyond the present. They can imagine a sequence of events that might occur. Thoughts can be influenced by logical principles rather than just their own perceptions and experiences. See what in the childhood days the child cannot learn from his experience, means they don't have an abstract thinking. They can't think that this activity of him or her will be leading to some another consequences. But as the individual is coming or growing into his adolescent period, he develops an abstract thinking. He can relate his activities for its further consequences. Okay, so that he can act accordingly. Sexual changes are they have increased desire, increased sexual desire. Sexual activities begin as masturbation or first sexual intercourse. People is curious to know about their own as well opposite gender, and they go on for experimentation and develop intimate relationships. Now, adolescents also have some health problems, not particularly that means not particularly the infective or other thing. Because of these developmental changes, there are some problems also. Biomedical illness are the same that pertain to every age group. Means there can be congenital malformations, defects that is occurring from childhood only. Precocious and delayed puberty can occur, short stature, asthma, congenital and rheumatic heart disease, tuberculosis and malaria. Means these all illness are not in our control. Okay. Now there are consequences because of risk-taking behavior. Nutrition problems occur because of the um, social social yeah, in which socio-economic condition we are living. This depend nutrition problems depends on the socio-economic condition, and there is reproductive health problems and mental health problems. Reproductive health problem is because the child is gaining the reproductive means reproductive activities is gaining reproductive activities, so there will be some problems of uh, pregnancy and means unwanted pregnancies. Usually unwanted pregnancies occur in this stage, and they can have mental health problem. Why there is mental health problem? Because the thinking uh, level and perceptions are changing in the individual. Okay. Why there is consequences of risk-taking behavior? There is unintended injuries, intended injuries, then STDs, HIV/AIDS, and because of substance abuse. Unintended injuries is because of the automobile and sports related accidents. Okay, intended injuries, you can see that violence, homicide, and suicide occurs in this stage in maximum people, because in the child who's dead, that the child is not able to think about himself, or they don't have any thinking or perception about something. They just rely on the um, pleasure they gain in the present moment. If the activity is pleasurable, the child goes on doing it. But as you enter into your adolescent days, the individual or the person start thinking that which activity of mine can cause what circumstances, and he and she will react accordingly. Okay, now why adolescents are important, why we are reading so much about this. So after various thinkings and various permutations, combinations, that adolescent has come to a conclusion why adolescents are important, and this is because they are a demographic force. You have seen that about 23% of India's population is composed of adolescents. So this 23% will become an adult in next few years, and will contribute to the economic development for to his economic development of himself, to the society and the family, and finally to the country. They are an economic force. Okay, they are the future of health, and they have a right to participate. Okay, that's why we are reading so much about adolescents. Now, finally, one more thing we are going to read, that what is the effect of removal of gonads. So, effect of gonadal removal depends on which stage of life we are removing the gonads. If we are removing before puberty, changes will be something else, and if we are removing after puberty, changes will be something else. So first let's see what are the effects of removal of testes. So if you are removing the testes before puberty, this will produce permanent sterility due to the absence of testosterone. The clinical picture which develops is called inocoidism, and the characteristic features are that pubertal changes will not occur. So there will not be any growth of hair on the face and trunk or axilla. Pubic hair pattern will remain as that of the female type, because some of the adrenocortical and adrenocortical endogenous secretion is present, which will be converted to estrogen, and there will be female hair type of pattern. Growth of larynx will be arrested and will remain in high pitch voice. Body configuration will resemble that of adult female due to the abnormal deposition of fat on buttocks, hips, pubis, and breast, and muscles are soft and poorly developed. Failure of development of accessory organs of reproduction, therefore penis, scrotum, seminal vesicles, and prostate will remain small, and some of the individuals are characteristically tall due to delay in the union of the epiphyses. That is, that since there is no sex hormone secretion, so there will be growth will go on happening. There will be increase in growth, and I don't know when there will be an arrest in growth pattern. Okay. Now, what about if you remove the testes after puberty? After puberty, there will already be an development of the sexual characters, secondary sexual characters, and accessory organs dependent on testosterone have already developed. But since because of the development, there these organs also need maintenance, which will not be happen. Thus, when characters or organs are depressed after removal of the testes, this situation is known as castration. Therefore, castration after puberty results in atrophy of seminal vesicles and prostate. There is no alteration in voice as the growth of larynx during the adolescence is permanent. The penis remains in normal size. Beard remains unaffected. Sexual desire and penile erection is little impaired, if at all, because it is due to psychological changes, and there may be hot flashes, irritability, and depression. Other body functions like lifespan, senility, intelligence are not affected. Now, what will happen if you remove the ovaries? This also will depend on what characters will be formed will depend on the timing of the removal of ovaries. If you remove the ovaries before puberty, then puberty will not be set at all. The menstrual flow will not occur. Secondary sexual characters do not develop. Therefore, presence of ovaries is essential for the onset of puberty. Okay. If you remove after puberty, there will be atrophy of the whole genital tract, that is the uterus, vagina, and the external genitalia structure. They will atrophy. Menstruation will stop permanently, and there will be vasomotor changes. What is vasomotor changes? There will be hot flushes, and they coincide with LH surge. There will be feeling of suffocation and night sweats. Breast size usually they will decrease in size or due to atrophy of the glandular tissue, or they may increase in size due to local accumulation of fat. Obesity develops due to diffuse deposition of fat. Effect on sexual desire is variable, but it often remains unaffected because it is independent of the sex hormones, and it largely is determined by the psychological factors. Emotional disturbance of varying degree, ranging from a certain amount of irritability or depression to insanity, can occur. Okay, so Tanner staging is important for in this chapter. Tanner staging, and some you can have a question about the psychosocial development or the problems in the adolescent age group. Okay, thank you.